name is Joanna Sinwell. I'm with the NAMI Johnson County. I'm on the board of directors. And also behind the controls there is Mary Issa, who is our executive director. But today we welcome Dr. Kay-Ann Zhang from the University of Iowa, Department of Psychological and Brain Sciences. And she's going to tell us about the Seashore Psychology Clinic. Dr. Kay-Ann Zhang is a licensed clinical psychologist and the clinic director of the clinic. The clinic is housed in the University of Iowa's Department of Psychological and Brain Sciences. She's a proud Hawkeye since she earned her PhD at Iowa nearly a decade ago and is returning now as clinical associate professor to direct the training clinic where she trained all those years ago. Her passion and experience and expertise is in disseminating and implementing culturally responsive science-based practices, including evidence-based assessments designed to answer various mental health-related questions and science-based treatments for various mental health disorders and difficulties. This means that we apply what has been shown to work to each client in a way that respects that person's needs. In some of her past work towards this goal, she spearheaded a training program to foster the next generation of the clinical psychological science workforce, creating university community partnerships to increase access to science-based practice, served on the advisory board of a multidisciplinary health initiative to reduce substance use problems in rural youth, and co-chaired a working group on advancing training within the Academy of Psychological Clinical Science. Welcome, Dr. Zhang, and take it away.
Thank you so much, Joanna and Mary. I'm very pleased to have the opportunity to get to know the community a little bit better and to tell you a little bit about ourselves at the Seashore Psychology Clinic. As you can see on this slide, we are housed within the Department of Psychological and Brain Sciences, and that is housed within the University of Iowa. All right, so this is where we're located. This is Stewart Hall on the northeast corner of the campus of the University of Iowa in downtown Iowa City. This building was renovated in 2012, and we are housed on the first floor of this building, where you see that dark orange color on the bottom floor there. That is our clinic. So if you come to us, there's several parking options that we write about in our website, which I'll give you the link to later. But if you come to our clinic, you'll just go through these double doors that you see on the bottom floor there, and the waiting room's right to your left. So super easy to find. I'll say right now that we are separate from the University of Iowa hospitals and clinics, though we do have significant partnerships and collaborations in both science and in practice with folks at the University of Iowa hospitals and clinics. So I'll just call them the hospital from now on, but I wanted to mention that we're not part of the hospital. So you'll need to contact us directly in order to seek services or to ask us questions. And I'll give you all that contact information. So in preparation for this lunch and learn, I took a couple of photos. They're not professional photos, so pardon the quality, but I took some photos of our clinic just to give you an idea of what we look like here. On the left two photos there, you see photos of our waiting area. So from those already, you should be able to tell that we serve people of all ages. As you can see, we have children's books and toys in the waiting area as our families come into the clinic. And then that second photo, when you normally walk through the door, you'll see the warm face of our staff member, Carrie Whitaker. She is in our clinic full time, taking phone calls, greeting clients, and working with me, who's usually sitting behind the scenes full time. So as you come through, you'll be welcomed by Carrie, and I'm always accessible through Carrie behind the doors. On the right here, you see two photos of different clinic rooms within our clinic. They're set up a little bit differently depending on the purpose. So the third photo you see there is typically set up for either an individual therapy session or a couple therapy session, whereas on the rightmost photo, it's usually set up for a bigger group, often bigger families. So we can accommodate all of these different types of needs in our clinic. Now, a little bit more about our clinic's training model and just how we're set up here. We are a training clinic, and that means that our clinicians are students, they're graduate students who are supervised by licensed faculty psychologists such as myself. And we have a small army of clinicians, student clinicians, and about 7 faculty members supervising. And in order to make sure that we're providing you with the best quality of care, we provide that close supervision, often through video recording of our sessions. We video record and we obtain consent from everybody coming to the clinic to video record, but we video record basically every moment of every session so that licensed psychologists such as myself can watch those videos and kind of know every little bit of what goes on so that we can provide feedback to our clinicians. And often, just to give you a better sense of what that looks like, how close that is, 2 sessions don't go past without meeting with a supervisor in between. So if a student clinician is working with a client on a weekly basis, they meet with a supervisor on a weekly basis. So they get supervisory feedback and guidance between every single session that they're meeting with a client. Just to give you an idea of how close that supervision is. I am gonna just make sure that I can see the chat all the time. So if people are popping questions into the chat, yes, I do see a question with regards to payment in the clinic. Unfortunately, at this moment, we are not set up to take Medicaid and Medicare. We are a self-pay clinic only, but we have priced our services so that they are as affordable as possible. And I'll say a little bit more about our fee schedule on a later slide. Thank you for that question. And also say one more thing. As we think about, as we meet folks who are seeking services and we think about what folks can afford, we're taking that into account so that if we do have to refer somebody out, we're carefully looking for referral destinations that can meet the client's needs. I hope that that helps. Okay. So with regards to our supervising faculty, who you'll meet on the next slide, as I mentioned earlier, we are all licensed clinical psychologists. There are a confusing, dizzying array of types of psychologists out there. There are school psychologists who mainly work in schools. There are counseling psychologists who mainly work in counseling centers at universities and such. And there are clinical psychologists. Of course, we all kind of cross paths at some point, but you can find clinical psychologists in academic departments and training programs like here. You can find us in the hospital. You can find us in various community services, but we are all clinical psychologists here. All of our faculty supervisors have generalist training. That means that we're trained to work with people of all ages from all walks of life, but also each person comes with their own specialty expertise. And I'll say a little bit about our individual expertise on the next slide. Our student clinicians, they are graduate students and they're working towards their PhD degree. Their PhD degree is in something called clinical science. And so I want to spend a little bit of time talking about the clinical science training model in a moment, but I see a question in the chat. So coming back to the payment question, please provide information on what the fee might be for a family that is on Medicaid and what options there might be for those that cannot pay. Okay, so I'll quickly speak to that and feel free to clarify in the chat if you're looking for assessment or therapy. I'm guessing you're looking for therapy. Our therapy fee scale is a sliding fee scale that ranges between $5 per session to $40 per session. And that sliding fee scale is determined by a combination of household income and number of family members. So the fee scale will come down as the income is lower and as there are more family members. Oftentimes we will end up at just a place where people feel like I'm comfortable to be able to pay this fee per session. And if the financial situation of the family changes, we can revisit that agreement as needed. So we have all different kinds of assessments that we do here. Most of our assessment types are have a flat fee of $300, flat fee for the entire assessment, no matter how many hours or how many visits that takes. And so that can range anywhere from a 2-hour face-to-face to like a 10-hour face-to-face, multiple sessions. We basically tailor the assessment to the question at hand. So however long that assessment is based on how complex the question is. And so we're willing to kind of spend the time, put in the expertise, as long as the client's willing to show up. So am I correct that there is no fee for testing needed for waiver approval? Yes, great question. So we have two specific kinds of testing assessments that are reduced in fee, and that's because these are two populations that are almost always quite indigent and struggling with income. And so we have one type of assessment which we call HCBS waiver assessments. These are assessments for intellectual and adaptive functioning to allow a person to qualify for home and community-based services. Those are free. So yes, correct. There's no fee for those waiver approval assessments. And actually, our wonderful staff member, Carrie Whitaker, has been beating the pavement to contact all the agencies in the area to tell them, please come on down, because we actually have quite a few clinicians in the clinic who can see these folks quite quickly this year in particular. Yes, you're welcome. I'll just say right now, since I'm already on a roll, we have a second type of assessment that is reduced in fee, and those are gender affirming. Those are evals for candidacy for gender affirming procedures for adults, and those are $25 per eval. All right. Let me know if there's any other questions, but I will go ahead and talk about the clinical science training model. So we've got this training program here that we're a part of. What it means to be a clinical science training model is that our students provide services with supervision and conduct research. And therefore, they are well positioned to translate science directly into practice for you, the community member. The fact that our students also do research doesn't mean that they're any less caring or emphasizing about the quality of the practice that they provide. In fact, our training emphasizes that our ethical mandate, so we take this ethical mandate very, very seriously, is to provide you with the best care we possibly can and no less. And so because of their research training, they're more able to translate the best science, the most up-to-date cutting edge science that we have at our disposal into direct care for you. So for the public, that means that we focus on proven, cost-effective, and time-limited treatments. For example, what can happen in a case, and I can say more about this throughout, but what can happen in a case is if a person walks through the door and we get a sense of your difficulties and we get a sense that we have a treatment that's well matched for that difficulty, but you have all kinds of factors that impact your ability to engage in treatment, like you have a lot of instability in housing or instability in schooling or work situations, we can tailor our treatment to make sure that that fits your needs. There are also cultural considerations. So if there is a cultural consideration that requires tailoring in a creative way, our students are best positioned to look into the literature. They do a literature search and they find studies that have tested a specific treatment in the population that matches your needs. So we don't just guess, and we don't go off of intuition, and we don't make assumptions. We do this collaboratively with the client. We have a conversation about what is your worldview, what kinds of experiences are you carrying with you into therapy services, what have you, and we're able to then take that back to the literature, the scientific literature, and find what's been proven for this particular population. So I hope that that helps. Please feel free to raise any questions. All right, I promised that I would introduce our faculty. So here are our current 7 faculty supervisors in our clinic. At the top right corner, there's me. You'll see who we are, but you'll also see our specialty expertise. So I want to say a little bit about that. Our clinical supervisors' expertise flow directly from their scientific work, their research. And that means that these are the folks that are on the cutting edge and have the most up-to-date knowledge about the difficulties in which they have special expertise in. So for instance, you'll see that I have specialty expertise in CBT, that's cognitive behavioral therapy for anxiety disorders, such as panic, OCD, social anxiety, things of that nature, in something called acceptance and commitment therapy, and also in CPT, which is cognitive processing therapy for trauma, for PTSD. Whereas Dr. Nicholas over on the left here has specialty expertise working with children, adolescents, and families, and with populations, both children and adults with ADHD. Her expertise is flowing directly from her research in the ADHD area. So she's able to bring that up-to-date knowledge to our clinic in ways that somebody without that expertise may not be able to. I'll just go through each of our supervisors so you can get to know them a little bit. Dr. Thomas on the left here, her expertise is also in acceptance and commitment therapy with specialty expertise in management of chronic illness and chronic pain. And that also flows from her research. She has several grants and research projects that are ongoing in these topics, as well as in stress and trauma. Dr. O'Neill has specialty expertise in dialectical behavioral therapy, cognitive behavioral therapy, and substance use disorders. And remember, we all have generalist training, so we're able to kind of crosstalk in all the different areas that are not mentioned here, but this specialty expertise is really helpful when we have a case that requires it. Dr. McCleary, who is on the call, she is a real boon to our clinic because she has specialty expertise in severe mental illness, psychosis, and that helps because it brings to bear in our clinic a group therapy to improve the quality of life for those living with schizophrenia spectrum disorders. So we're really grateful for her expertise in our clinic. Dr. Denberg, here on the right here, her expertise is in neuropsychology, so she supervises a lot of assessment cases. And in particular, she also works in the clinic over at the Iowa River Landing, where she sees folks with integrated mental health, neuropsychology, and primary care difficulties. So her expertise is in geropsychology, aging, and dementia. And finally, but not least, Dr. Peterson shares Dr. Nicholas's specialty expertise working with children, adolescents, and families, but he also brings to bear his expertise in parent management training, which is a very specific kind of therapy that we provide where the purpose, the focus of kind of therapeutic work is with the parents to provide them with the skills to translate some of the gains that kiddo makes in therapy to home. One of the difficulties that we see when we work with kiddos is we can make some headway in the therapy room, but it can maybe not translate to the home environment. Parent management training is really wonderful for helping the parent to speak the same language as the kid and what the kid is learning in therapy so that they're able to boost those gains and maintain them and maybe even amplify them at home. Okay, so I see a question in the chat, which is a good one. Does a client have to participate in research to attend the clinic? Absolutely not. It will, I'm pretty confident I can say this stretching into the future. It will be the case that anything we offer in the clinic, we will not require research participation. Someone can volunteer. In fact, 100% I can say this. In fact, it will never require research participation. So the services will be available, research participation will be voluntary. Thank you for that question. That's a good one. So you can always walk through the door, request services. You will never be pressured to participate in research. If we do have a research study, we'll ask if you want to, and we'll give you informed consent, but you don't have to. And your data will never be used for research without your consent. Let me just take a moment to see if there's anything else that I want to say about faculty expertise. I will say that the difference between my role and the other folks that are supervising in our clinic is that I'm really the only full-time faculty member that's kind of in the clinic full-time Monday through Friday, open till close. You'll be able to see our hours on our website, and we do offer evening hours. We have hours till 6 on Tuesday and hours till 7 on Wednesday, which tends to help with families who need to get their kiddos here after school, parents that can't leave work during the day, that kind of a thing. So we try to make our services accessible. Um, but the difference with me being clinic director is that I'm really the only person that's kind of here full time. Our other faculty members are here when they're supervising a case, and at other times I'll be kind of the touch point that will relay and coordinate between all the different cases, all the different clinicians. So I'm kind of there to oversee the clinical side of our students training in collaboration with these other wonderful clinical supervisors. um, let's see. All right. And I think I already mentioned that the way that we touch base with, the way that we interact with other providers in the community, such as the hospital, but not just restricted to the hospital, is that we form partnerships. So, for instance, we liaise with providers both at UIHC, the University of Iowa Hospitals and Clinics, but also large private practices in the area, such as Meadowlark, Psychiatric Associates, um, a couple of other Anderson and Arnold. We also liaise with residential service programs when we need to either refer somebody to a higher level of care or when we're receiving referrals from agencies such as Systems Unlimited. So we're kind of plugged into this network of providers and we're able to get folks to the right place. Okay, so I want to say a little bit more about our services. I'm glad that the question about fees already came up front and center. I was going to mention that here. Our services fall under 3 large buckets, and that's assessments, individual therapy, and group therapy. So that's the best way to think about it. Assessments are kind of a set of psychological tools that we design tailored to your specific need to answer some kind of specific question about your psychological functioning. So that might be a question of, do I have X, Y, or Z diagnosis? It might be a question of, do I qualify for a home and community-based services waiver? It might be a question around, would I benefit from accommodations at my school or workplace based on my difficulties? So these are all different types of questions that we're well suited to answer. As I mentioned earlier, the assessments are typically flat fee of $300 with the exception of the waiver assessments, which are free, and gender affirming evals, which are $25 per eval. These assessments, the way that they typically look, as I mentioned earlier, they can really range depending on the complexity of the question. So they're typically a couple of different visits. At least one visit contains a clinical interview. That's usually the first visit. And then at least one visit is a feedback where we have already written up the report. We go through it in great detail with the person that is seeking services. We explain what everything means. We take questions. We address concerns. We explain we walk people through our recommendations. So we're not just kind of delivering a report into thin air and say, hello, thank you, bye-bye. We really take the time to explain and to connect people with the next step in their care. Assessments, as folks probably already know, it's not quite like therapy, right? We see you for the assessment for maybe a couple of different sessions, but we're not seeing you in an ongoing way in a weekly manner. But we still really believe in a warm handoff when we can, and at the end, making sure that what we're doing works for the individual that's seeking the services. And that means explaining everything as best as we can and addressing concerns as much as we can. Of course, we provide individual psychotherapy, and I explained the sliding fee scale earlier. That typically looks like one-on-one sessions weekly with our student clinician. And as I mentioned, supervision occurs in between every single one of those sessions so that you're getting that assurance for high quality care. I'll also say a little bit generally about group therapy. We don't just have our CBSST group, which I want to make a plug for. at different times, we'll have other types of groups. For example, in the past, we've had an acceptance and commitment therapy for trauma group that we were recruiting for and enrolling for. But that really just depends on faculty expertise and the availability of that faculty to run the group at the time. So we'll always put announcements about availability of groups on our website. And we'll usually also reach out to other big kind of providers. We'll make sure to reach out to NAMI when there's a new group running, just to let folks know. So generally, group sessions here are with one or two clinician facilitators. That can be clinician and faculty or clinician and clinician, really depends. They're usually weekly, and the fee per session is going to be determined per group. So for this particular group I want to make a plug for, which is called CBSST, that is run through our clinic by Dr. McCleary and colleagues. This is a recovery-oriented group designed for people living with schizophrenia spectrum disorders, and the fee is meant to be as affordable as possible. They're $1 to $5 per session. Again, that's on a sliding scale. We want people to be able to attend it. We want it to be accessible. And we're currently enrolling for that group now. So if you have a schizophrenia spectrum disorder or you suspect that you have such a difficulty, please reach out to us through our contact phone number and email. We'll get you connected with the right person. I do see some questions in the chat, which is wonderful. Is there a wait list for therapy or assessments? Yes. So we do maintain wait lists. They're typically quite short. At the same time, being a training clinic, our capacity fluctuates with the semester and with the number of clinicians that are available to do any specific kind of service. So whenever our wait list shrinks and is really, really small, me and Carrie, we're kind of making the rounds and letting people know, get in quickly because we could see you really soon. But we maintain a wait list. So if you're interested, call in. We'll tell you how long the wait is, and we'll typically check in pretty frequently to see if you're still interested in services. At minimum, the wait is probably like a week. At maximum, the wait is probably a few months. So I'll say that as a range. I know it's may not be super duper helpful, but I also know that the wait lists in the community can be quite long too. Do we do autism assessments? That's a great question. Unfortunately, we're not really set up to do kind of your Cadillac battery for autism assessments. For people who come in with a question primarily around autism, we actually refer them over across the street to Meadowlark because we do know that there's a couple of colleagues, collaborators, wonderful people over there who do specialize in autism assessments. I hope that helps. Thinking of continuity of care, how many times can a client expect to see a student? One semester, more or less? That's a great question. So we are very mindful about continuity of care. We keep our clinics open during the summer. So it's not like the semester has ended and all of a sudden we need to close up shop. If a student is graduating out of residential studies here and they're moving on to internship, say. Internship is kind of like our residency where they leave our program and they go to a hospital and they do additional training there. So they're like moving out of state most of the time. But unless they're leaving the state, we try to maintain continuity of care whenever we can. And if a client can still benefit from services, then we can refer internally. We can go from one student to another student, and to maintain that continuity, we can keep them with the same supervisor even. So we're really, really mindful about that continuity of care. Typically, we have a number of folks who stay on kind of to wind down over the next semester if needed. And if that's the case, we typically try to maintain them with the same supervisor. But like I said earlier, I might say one more thing about that. Like I said earlier, we do provide cost-effective and time-limited treatments. And some of the treatments that we use, which I'll speak about more on a following slide, they've been shown to work in anywhere between 6 sessions to 20 sessions. So if you really think about that, this can be really brief. Therapy that works can be as short as a little over a month if people show up every single week. They can be and at the kind of at the max end, then we're kind of looking at several months. So it can take a semester to get a person to the kind of functioning that they want to meet a very specific goal. And that goal is always set collaboratively with our client upon intake. So we don't just dive into therapy and hope we find out what the issue is and what the person wants to achieve. We do that right up front so that we know the goal and we have a compass, right? Okay, last question. Do we use interpreters for those for whom English is not their first language? That's a really good question. Our capacity really varies. Um, we have specific kinds of assessments for which usually kiddos from families that are typically a little bit lower income. Those types of assessments we have access through a kind of a very specific pot of funding to have Spanish interpreters to help us, and they come to us from the hospital. That funding comes to us by grace of the University of Iowa hospitals and clinics. So they're able to share their interpreters. That one doesn't have to be Spanish. They can make available any of their interpreters, including Arabic and etc. But that's a very specific kind of assessment. For our ongoing therapy, unfortunately, right now, we don't have the infrastructure. I'm always exploring more options. So that may change in the future. Thank you. Thank you for your questions. All right, I'm going to move forward just a little bit more granular detail about the types of assessment and types of therapy that we'll be able to provide. As I mentioned earlier, we really like to be able to match a person's difficulty with the specific services that we provide. So that's why we have this level of granularity, because we know that these things, both these assessment tools and these therapy approaches have been shown to work for the difficulties that people are coming in with. So the types of assessments, as I alluded to earlier, we provide those intellectual and adaptive functioning assessments towards home and community-based waivers. Learning difficulties and accommodations assessments. So those referrals typically come to us from student disability services, schools for which kiddos need IEPs, people who are seeking accommodations in the workplace, or accommodations for like the MCAT, some kind of like occupational testing, all kinds of different referral sources. We do evals toward candidacy for gender affirming procedures. We do our kind of psychodiagnostic evals, which just means, do I have this or that diagnosis? Typically, we get referrals for, do I have ADHD? That's both children and adults, and also severe mental illness by way of Dr. McCleary's expertise, which is great. There's a variety of other types of psychological questions we can address. Just call us if you have a question that you want to get assessed for, and we'll let you know if it's a good fit. If not, most likely we know some other community provider that we can provide that we can refer you to. And for therapy, the different types of symptoms and difficulties we typically see include depressive and anxious symptoms. That really includes depression, anxiety, panic disorder, agoraphobia, obsessive compulsive disorder, PTSD, trauma, specific fears. So if a person has a fear of heights and they really need to be able to climb to the top of the Eiffel Tower, we can do that. We're able to help folks with managing stress, grief, and difficulty adjusting to life circumstances, manage chronic pain and illness. We see children and adolescents with emotional or conduct difficulties, and we help their families as well. And finally, we have that CBSST group, which is recovery oriented for people living with schizophrenia spectrum disorders. So this is just a quick rundown of what we can see. If any of this sounds like something that you're interested in and you have a follow-up question, don't hesitate to pop it into the chat or reach out to me directly. I'm going to say one more thing about the previous slide here. So I said that we really care about matching you with the type of help that you need. One way that we do that, specifically for therapy, whether it's individual or it's group, is through a very thorough intake process. Our intake process is consultative. That means that we do a fairly thorough assessment. We get a sense of your goals. We get a sense of what types of treatments might be helpful for you. We describe those treatments, and then we ask you, does that sound like something that you can do or you'd be willing to do? And how might we work with you to make that work for you? And if it doesn't sound like it's a really good fit, which is decided collaboratively between you and your clinician, then we'll provide you with a referral out. That's what it means for that to be consultative. And because it's consultative, it's always free. So, somebody can come in for therapy and be a really great match for what we provide, maybe not ready for it yet. We'll say, great, it's fine, intake is free, come back when you're ready, right? Or somebody might come in for an intake, it's free, but we don't provide the type of services that we know they'd benefit from. We'll make sure to give them the information and as much help as possible in connecting to that service. So I hope that that helps, just knowing a little bit about our intakes. All right. Joanna said earlier that my passion is in disseminating culturally responsive science-based practice. And that's why I'm directing this clinic. So these are the two cornerstones of our philosophy in the Seashore Psychology Clinic. One, that we provide science-based practice, and two, that it is right for you. So when we say science-based practice, what that means in our two big buckets of assessment and therapy means this. For assessments, that means that all of the tools that we choose to put into that group of tests that we use for you have been developed in scientific labs through years, if not decades, often decades of testing. And we only use tools that are reliable and valid to answer the questions that you come to us with. Reliable means that you can get tested on 3 different occasions and get the same answer if the underlying thing that we're trying to measure is the same. It means that you can go to 3 different providers in our clinic and they'll all tell you the same thing if the underlying thing we're trying to measure is the same. So you can trust that answer. Valid just means accurate. If you're getting the same 3 answers from 3 different providers, that it's the right answer. It's not the wrong answer 3 different times. So we do a very diligent job in choosing the right assessment tools to hit that reliable and valid mark for your purpose. For therapy, science-based practice means that all of the treatments that we select to deliver in the clinic have been shown to work through years, if not decades, again, often decades of scientific understanding, and that they're shown to be matched to the disorder to work. Not every single treatment works for every single difficulty. In fact, some treatments are quite specific, and not every single treatment is well matched to every single population. Again, some are quite specific. And so we have that knowledge to be able to match the care to your needs. And when we say we take cultural responsiveness really seriously, we do. We're really client centered. So no matter what you're coming to us with, whether you're struggling from depression, anxiety, grief, emotional difficulties, raising family, we strive to understand the entire you. So your whole world, including your worldviews, your past experiences, often the experiences we carry with us, that whole universe or galaxy that we carry with us, really influences how we're perceiving our care, how we relate to our care providers. So that all makes a huge difference to how we provide the care for you, right? And so when we say culturally responsive, we really take the time to understand those aspects of who you are and tailor our treatments, even though they come from the science, they come from the labs, they weren't designed for you. We take care to make sure that we understand who you are so that those treatments are tailored to your goals and the life that you feel like is a good life. So in that way, our clinic makes science-based practice work for the person in front of us. Any questions about that? Any questions about how we marry these two cornerstones of our philosophy? This slide is about why choose us So I'm going to say, assuming that you're ready to choose us or you're ready to recommend somebody to choose us, this is how you can contact us. Again, we are the Seashore Psychology Clinic. You see our link at the bottom here below, psychology.uiowa.edu/seashore-clinic. You'll find our hours. I believe I also recently put our regular clinic closures. We have a couple of weeks throughout the year that we close. I put that on the website. You'll see information about parking, a bunch of different things. And you have our clinic contact info on the right here. You can call us. All the hours that we're open, Carrie's ready to take your call, and or forward it to me. And you can email us, and that email will work for all our clinicians, all our supervisors, myself, Carrie, everybody in the clinic. And you know what? I'll also bop my my personal email in the chat if anybody wants to reach out to me directly. All right, I see a question in the chat. I wonder if you could touch on evidence-based care versus science-based care. Are they the same thing or are they different? So yeah, absolutely. I'm happy to kind of get into that distinction. It's a little bit of a jargony distinction, but it matters to us. So healthcare, specifically mental health care, has gone through all these different phases. When we were still a quite young field, the push was for something called evidence-based care. The metaphor, that the analogy we often use for evidence-based care was this three-legged stool. One leg is research, one leg is clinician expertise, so what the clinician thinks is best and what they've been trained on, and the other leg is client preference. And so the stool rests well when we have all three in play. But the real drawback to that evidence-based care model was it really didn't favor or specify how much of each of these three legs were required to make the whole treatment go for the person in front of us. And so oftentimes the decision making rests either too much on clinician preference. So you might have a clinician who says, I was trained in this, I'm just going to use this. Or I wasn't trained in that, so I'm not going to use that, rather than match it to the needs of a specific client. And so what we do when we provide science-based care is we're very, very careful to always go to the science first. We don't use anything that hasn't been shown to work. So that's a kind of a first constraint that we go through. It's the first filter that we go through. And in that way, I think we try to live up to our ethical mandate so that we're not resting too much on clinician expertise, or even like sometimes client preference is really, really important, but that has to come with informed consent, right? If a client says, I really want this particular kind of service, and we know that that's not going to help you, we'll talk to you about what that means. We'll talk about how our treatments may or may not be a good fit for you. The treatment that you want may or may not be a good fit for you, and have you be able to pick. So that collaborative conversation, I think, is really important to empower the client first and foremost. I hope that that helps. I see one more question I'll try to address really quickly. Are providers able to work together with school and child family for truancy and school refusal situations? We certainly can for those types of problems. Just have them give us a call. Right now, the Iowa City District schools are using a specific platform called Care Solace to refer families over. So we've been getting our referrals through Care Solace, but anybody can reach out to us directly.
Do you see veterans or work with the veteran administration here in Iowa City?
We have collaborations with the VA. So we send our students over to the VA for training. So when they come back to us, they have some of the training that they gained from the VA. If veterans want to come to us, we're always an option. Absolutely.
Cool.
Yeah.
This is very good. Thank you.
Thank you. Thanks everybody for your time.
Yes, thank you so much, Anne. That was very helpful. How long has Seashore Clinic been in operation?
I believe since the 60s, but I don't feel super confident. I was trained here myself in the early 2000s and sorry, in the late aughts and early 2010s. But Carl E. Seashore started this clinic well before then, and it was here in the actually in the Seashore Hall before it moved to Stewart. I see a last question in regards to truancy. I'm wondering if you're able to collaborate directly with a school outside of therapy sessions. So as long as the client and the client's family sign a release of information, we're happy to communicate directly with schools. Sometimes it can be really helpful for the clinician working directly with the kiddo to explain what they're seeing and what the kiddo needs.
Let me remind everyone that we will have our Lunch and Learn next month on April 17th, same time. Our own Libby Conley is going to be talking about the intersections of faith and mental health. So please join us there. We also need some ideas on promoting our Lunch and Learns and ways to get the word out. So if you have colleagues that would like to hear more about these too, please pass on the word.
I have one more question for Anne, if I may. Do you have a specific release of information form for your clinic that you like to have signed, or can we just use it? I'm with the school district. I'm wondering if you have something in particular, or can we just use our form?
You can use your own form. If you send your form that's already been signed right to us and it's a two-way form that allows us to speak both ways, it'll work for us. I know that the hospital has a very specific one for their release of records. Ours will use any of the forms. When we originate the form, it lives online. So we'll send ours to you if we originate the form, but it's all good.
And I'm sorry, one more question. Is there paperwork that has to be filled out before the intake session? I work with a lot of families who struggle to get packets done, and so that's something I sometimes will help support. So if there is something that has to be done, I'm wondering if that's something you could share with me so I could help families with that.
Absolutely. Typically, the process is we'll receive the referral from either the clients themselves, their families, or provider or school, and Carrie will initiate a welcome letter that has the instructions to fill out that intake packet. So if we know that that needs to go to somebody else who can help to coordinate, and we already have that signed consent from you, we'll just go ahead and send one to you too.
Thank you, Lori, for all your questions. Those were helpful for everyone. All right. Well, thank you everyone for joining us, and we'll see you next time. Thanks again, Dr. Zhang.
Thank you.